Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. Welcome to Dr. Singh's podcast. And today we have a very, very special guest, the author of Truth of Contagion, Dr. Tom Cowan. Welcome to the show, sir.
Thank you. It's actually Cowan, but you can call me Tom.
Hi, Tom. Thank you so much for joining us today. There's a HPV vaccine drive that's being launched in India with a target of injecting 1.15 million girls with the HPV vaccine with the target of preventing cervical cancer deaths in India. So that's the topic for today. And before we come to the topic, I would love you to introduce yourself to the audience.
Just grew up for sort of regular in suburban Detroit, Michigan, and uh, all I can say is I didn't want to be a doctor. Um, so I joined the Peace Corps, went to Africa to teach gardening, and there I learned that there was a different way of being a doctor than what I had learned. And then I realized I was actually interested in the subject. So I went to medical school and did some residency and worked as an ER doctor for a while and had a holistic practice for about 40 years in various places. And most of that time I was trying to figure out what in medicine and biology was actually true and what wasn't. And I started going through, does the heart pump the blood? Which I found out no. Do blocked arteries cause heart attacks? Turns out no. Is cancer a genetic disease? Turns out no. Does DNA hereditary material? And that turns out no. And then eventually I came to the virus question, and this was later, mostly because I didn't look into it really. I knew that HIV had nothing to do with AIDS, but I didn't know. So with COVID, I decided to look into the virus question. And what I found really was kind of, even for me, and I don't say that like I'm some special guy, but I mean, I've been doing this for 40 years. And I was shocked at how unscientific and just what a scam virology was. And so I wrote about it. And since I wrote that book, I've learned a lot more, luckily. That's sort of what happens when you write books. And so some people would say I'm one of the leaders of the so-called no virus community around the world. I don't know. Nobody elected me to be the leader, but I'm sort of de facto something like that.
Right, right. Thank you so much. And yes, we will have some questions on that no virus theory. Today's podcast is to try to educate and make the parents who do not have the informed consent about the HPV vaccine. And definitely, we will talk about whether HPV virus even causes the so-called cervical cancer or not. If we want to talk about the vaccine, HPV vaccine, so the government is claiming that if we inject 1.5 million Indian girls with this HPV vaccine, we will be able to save say 70 to 80,000 deaths caused by cervical cancer. So do you, with your expertise, believe that this claim is true? Is the vaccine really effective?
Uh, this simple, straightforward answer is no. The HPV vaccine can't prevent any deaths from anything. And I don't hate to go back to this, but the reason is not only does the HPV human papillomavirus not cause cervical cancer, therefore there is no gain from the vaccine. It's all risk, no benefit. Not only doesn't it cause cervical cancer, there is no evidence that an HPV virus, human papilloma virus, actually exists. And it's hard for invisible flying unicorns to cause damage until you prove that there actually is an invisible flying unicorn.
Exactly. So I would love you to elaborate a little more on the point that the HPV, that is the human papilloma virus, doesn't exist or doesn't cause disease. Can you explain a little bit more on this?
So we have to go back to, and by the way, for people who haven't heard me or some of my friends before, you will obviously have questions. What I encourage you to do is actually go to your doctor who wants to give you this vaccine and ask them the following question, which I'm going to ask right now. How does a virologist, how did they prove the existence of an human papillomavirus and show that it causes disease? Now, I can pretty much guarantee you that your doctor will have no idea of how that happened. I worked as a medical doctor for 40 years, and I would have had no idea how to answer that question. To me, that's like going to a mechanic because your car doesn't stop, and you say, "Can you look at my brakes?" And they say, "What's a brake?" That doesn't make me have a lot of confidence that I should go to this mechanic. But that's what they'll say. Now, so we get back into did virologists prove the existence of viruses, right? So you have to go back into the history. So what happened was around 1900, they said diseases are caused by microbes, the germ theory. And they tried to isolate bacteria, which you can do because there are bacteria, and then they would give them to healthy people or animals. And unfortunately for the germ theory, none of the people got sick. Uh, Anyways, that didn't discourage them, so they kept going on, and they did funny things to make it look like it. But then they had diseases. The first one was polio, that they couldn't find a bacteria. So they said there must be something smaller than a bacteria that's causing polio, and we can't see it. And so we're going to call it a virus, which was the old Latin word for poison. So then they said, okay, we're going to isolate the bacteria, the virus, sorry, and show that it causes disease. So here's how they did it. 1908, famous paper. I never heard about this in medical school. They took a child who died of paralysis, right? They didn't know why this child died of paralysis. The part of their spine called the anterior horn cells looked diseased when they did an autopsy. So they took some of that. They said the virus must be in there. They ground it up, put it through a filter to get the big stuff out, put that in a syringe, injected into the brain of two monkeys. One monkey died and one got paralyzed, and they said, see, we've proven that polio is a virus. And I read that in 2020, and I thought, you have got to be kidding me. Because, first of all, they didn't see a virus in there. That's not the only thing that was in there. And they didn't inject normal brain into a monkey. Maybe monkeys don't like having, dead brain or dead spine tissue injected into their brain. But that was the proof, right? So then they do that for about 50 years, probably 100,000 monkeys. That's, by the way, called the isolation of the virus, which is a weird use of the word isolation. Then in 53, somebody says, I'm going to inject healthy spine into a monkey's brain. And you know what happened? The monkey died and the other one got paralyzed. And he said, well, that way is disproven. And so we have to find a new way to isolate the virus. And they were lucky because the next year there was a paper by a guy named John Enders who isolated measles virus for the first time. So here's how he did it. He took a child who was sick, allegedly with measles, took some of their mucus, filtered it just to get the debris out, put that on a growing culture of monkey kidney cells, added kidney poison antibiotics, took away the food of the culture, added horse serum, cow serum, and chemicals like trypsin, waited 3 days, and the monkey cells died. And he said, that's the isolation of the measles virus because the virus, which we didn't see in the mucus, killed the kidney cells. Now, I happen to have that paper. He got a Nobel Prize for this. And it's so interesting. He says a second agent was obtained from uninoculated culture of monkey kidney cells. The cytopathic changes it induced could not be distinguished from the viruses from the measles culture. So, what does that mean? He did the whole experiment again with the monkey kidney cells and the antibiotics and take away the food, but he didn't add anything from anybody with measles. And what happened was it was indistinguishable. The cells died, just like the virus one, so called. And yet he still claimed that it was the virus that killed the monkey kidney cells. And I swear, when I read that, I just thought, this is the biggest bunch of BS I've ever seen. And to this day, Kamal, that is how they isolate a virus. SARS-CoV-2, they took a mucus from somebody they said had COVID. They put it on monkey kidney cells. They put two antibiotics that are poisonous to kidneys. They took away the nutrients. They added some chemicals and some cow serum, and the monkey kidney cells died. They didn't do a control, and they said we isolated SARS-CoV-2.
Hmm.
Now, what's so fascinating about HPV, which is our subject, is they were unable to isolate the virus with the culture, with the kidney cell culture, or with a liver cell culture, or any kind of culture. They could never isolate the virus. And so there was a conversation about this in the medical literature. And they said, why can't we isolate? I mean, that is a bizarre use of the word isolation because they never saw anything. They just broke down kidney cells, which they knew would break down if you just poisoned them. And by the way, we did that experiment in 2021, and the kidney cells broke down. We didn't add anything from anybody with COVID. And we saw pictures in there in the electron microscope, which were identical to published pictures of SARS-CoV-2. Those have been proven, all the microscope pictures, because people are going to say, oh, but Kamal, I saw pictures of it. But what you don't realize is that if you do pictures of the kidney cells, no COVID, anything in there, you get the exact same pictures, and that is what it says in the medical literature. And then they take the genome, the pieces of genetic material, never have, and they don't know where it's from. Is it from the kidney cells? Is it from your mucus? Is it from the bacteria in your lung? They don't know. They break it up into little pieces. They put it in a computer and it spits out a million different possibilities, and they choose the one they think was SARS-CoV-2.
Hmm.
Anyways, with HPV, they couldn't culture it, so they couldn't isolate it, and so they had to make up a reason why, right? Because they couldn't get it to. So they said, well, HPV needs keratinized tissue. In other words, like a cervix. And since cervix tissue doesn't grow in a culture, like Tom, you dummy, well, of course we can't culture it because it doesn't have the right medium. That's what's called post hoc rationalization, which means they made up a story to explain why they couldn't culture it. So then they say, okay, well, what we can do then is take pieces of DNA,
Hmm.
and we don't know where they came from. We can have them attached to something in this ground up cervix tumor, And if it matches, that means it was caused by HPV.
Hmm.
And if you ask this question, how do you know where those pieces of DNA from the cervix came from? There could be fungus, there could be bacteria, there's you. They've never separated any virus from the person
Hmm.
that the virus came from. Never. They say that. The NIH says it, the CDC says it, clear as a bell. We've never separated and had a pure virus sample
Hmm.
apart from the host. In fact, they say you can't do that. And so they say the virus has to be in the cell.
Hmm.
And what's so bizarre about that is you say, well, how does the virus go from one person to another? In the
Yeah.
cell? No, it goes out of the cell. Wait a minute. You just told me 5 minutes ago that it has to be in the cell.
In the cell.
No, it gets out of the cell and goes to the next person. Well, well, why don't you catch it then?
Hmm.
Because it doesn't have a. No, you can't catch it then. There's not enough to catch. How many of them are there? 100 million per sneeze. How many do you need in order to catch it? 200 million. How do you know? Well, because we can't catch it with 100 million, so it must be 200 million. I mean, we're talking like nutcase stuff.
Yeah.
Now, again, you people listening are going to think, I don't know about this guy. He wears a funny vest and all. He doesn't. I know. Like I have a cousin who's a virologist. He's really smart. He would never fall for this. Fine. Ask him how show me the paper that isolated HPV.
Hmm. Hmm.
Doesn't exist.
Right. What I understood so far, let me bring it to the audience. So what you're saying is HPV was in reality never isolated and purified and shown to cause the disease that is cervical cancer. So basically, if a
It was
virus,
never shown to exist.
uh-huh. So we just stop on that point that it doesn't even exist.
It's never been shown. There is no published here. So if you wanted to do this, it's the way to explain this to people. It's very simple because if you use some other example, which we're all familiar with, it makes sense. So if I say, Kamal, I think there's frogs and frogs eat flies. And you say, how do you know? Right? Because you got to. So I go to a pond where frogs live and I have a net and I scoop out the frog and I have only a frog and then I put him in a cage or something with a bunch of flies and I watch them eat the flies. And if I want to know what a frog is made of, I can get the frog, only the frog. And if I'm a mean person, I can cut the frog up and see it's got tongue and bones and all that stuff. Right?
Yeah.
Same with the hammer, same with the bacteria, same with an elephant. Now, if I said, no, here's how we're going to do it. We go to a pond, no frogs. We go to every pond in the world, never see a frog. That's what they say. Can you show us any virus in any fluid of any sick person? No. Okay, you go to all the frogs, never see it. All the ponds, never. Okay, I'm going to put some dynamite in a pond and then I'm going to blow it up. And I think there's a lot of pieces in there. And then I'm going to put them in a cage with some flies, with some snakes and some other things that eat flies. Like there must be other things. And then I'm going to come back the next day and see if there's less flies. Oh, there is. That means there's frogs. I mean, if somebody told you that, you
Yeah, that's crazy. So what I am trying to make out from this is that cervical cancer is not caused by a virus. And there's another question. What is cervical cancer? I think you would like to explain that also.
Well, that's a whole nother question. But right, the first step in understanding the vaccine, and by the way, then that question you asked, I think, should come a little bit later
Hmm.
because so what are they trying to do with the vaccine?
Right. Hmm.
That's I think the next thing. So they can't find the virus. So what is in the vaccine?
Mm, yeah.
Well, usually they take a cell culture,
Mm.
right? So they take snot, some mucus from somebody with measles, grow that in the cell culture. The cell culture dies. They put that broken down cell culture with a few other things into a vial, and that's called a live viral vaccine.
Hmm.
So you're injecting broken down monkey kidney cells with some antibiotics and some other things like aluminum, et cetera, into your body. Nobody saw the virus. Nobody proved there was a virus. Nobody proved that virus has anything to do with that alleged disease. Now, the point is to make antibodies so that you're immune. And that's how they measure the effectiveness. So they give you this live viral of measles, which has never shown to have a measles virus. It's a broken down culture, and then you make increased number of proteins. Why? Because they poisoned you.
Hmm.
Now, here's the next important point. Are these so-called antibodies specific to a measles virus? So let me read you from the world's leading expert on antibodies, a guy named Clifford Saper from Harvard, head of Harvard Neurology or something. He has a journal about antibodies. There is no such thing as a monoclonal antibody that, because it is monoclonal, recognizes only one protein or one virus. It will bind to any protein having a same or similar sequence. In other words, they've never been able to prove, in fact, they've disproven that the antibody has any specificity to that so-called virus. Now, here's the other thing. You've heard that you get a virus, you make antibodies, you're immune for life, right? That's the whole point. That's the point of an HPV vaccine.
Right.
They give you the virus, you make antibodies, you're immune for life.
Yeah.
So you get measles, that's a virus, you make antibodies, you're immune for life. You
Yeah.
get mumps, that's a virus, you make antibodies, you're immune for life. You get the flu, you make antibodies, and well, you're only immune for a year because the flu virus is smart and it knows how to evade the antibodies. And then you get AIDS and you make antibodies, and that means the virus is going to kill you. And I remember hearing that in 1984 when I graduated medical school. I heard on the television, Robert Gallo said, "We discovered the cause of AIDS, it's HIV, and we know because some of the people with AIDS have antibodies to HIV. And antibodies mean you're going to die from the virus." And I turned to my friend and said, "Wait a minute. I spent 4 years learning that antibodies mean I'm immune. And this clown gets on the television and says, no, antibodies mean you're going to die with the virus." So, in other words, if they say, well, you make antibodies to HPV, oh my God, I'm going to die from the virus. How do you know whether it's all that means is the whole thing is nonsense.
Yeah, it's complete nonsense. So basically, what you mean that the entire vaccinology is complete scam.
It's a complete scam. Now, let's say one other thing about the HPV vaccine that's very interesting. Uh, and I know you asked this in your questions. Some people say that there's never been a vaccine that has had a proper control done. That's not true.
Hmm.
HPV did. And here's the story. So Merck, I think it was Merck, who did the initial trial of the Gardasil. That's an HPV vaccine. I don't remember the number of young women they vaccinated with the Gardasil, and then they measured in the next 6 months how many of them got diagnosed with a serious autoimmune disease. Never mind that there is no such thing as an autoimmune disease. anyways, they got seriously ill that they expected to last the rest of their life. And so they got 2.3%.
Yeah. Hmm.
In other words, out of 100 girls who get this shot, two to three of them will, because of the shot, they said, or maybe because of the shot, will have to end up with a lifelong diagnosis of a bad disease.
Hmm.
And then they did a control,
Hmm.
and uh, they got the exact same number, 2.3%.
Yeah.
And they said that proves that's just the normal amount of girls who get a horrible disease every 6 months.
Uh-huh, that's right. So I'll read that package insert for you. So it says that if there was 10,000 girls that were included in that trial, and it says 120 got arthritis, there are 35 hypothyroid, 27 hyperthyroid, there is psoriasis in 13, there's type 1 diabetes in 2, celiac disease in 10, and there's so many more. So it's 2.3% side effects that is confirmed by the vaccine industry itself.
Yes, but here's the important and very interesting point. So they did a control and they got the same number. Now, here's the important point. What was the control?
Yeah.
So remember, here's what a vaccine is. They take some stuff from a ground up cervical lesion, put it in a cell culture, or put it in some vat with stuff, and then they claim that's a live viral vaccine, and then they put some adjuvants in it to make you make more antibodies. So they call the cell culture bit, that's the active ingredient. That's the quote virus. So for the control, they left the adjuvants in, the aluminum and all the other stuff, chemicals they put in, and they took away the cell culture part, and they got the same amount. Now, here's where it gets interesting, and I'm convinced to this day that somebody at Merck went rogue,
Yeah.
and he decided to inject, I think it was 1,000 peep girls with saline. In
300.
other words, it
I,
was the only vaccine where the control was actually not just the part of it that makes you sick,
uh-huh, uh-huh.
but it was nothing. It was salt water. And
Mhm.
you know how many got these horrible diseases that were 2.3% in the control and in the experimental group with the HPV?
I think something around 1%, zero.
Zero.
Mm-hmm.
In other words, the reason why when they do placebos that are the poison part,
Mm-hmm.
not that injecting yourself with a cell culture is good, but it's the aluminum and all the other stuff that they put in there to make you make antibodies.
Mm-hmm.
That's the real dangerous part. And
Mm-hmm.
that's what they left in the control. And except some guy went rogue and did it without that and showed that that's the part. So it's the only time they did that. After that, they said, we're never doing a saline control again. The control for a new measles shot is a mumps shot with the same ingredients in it. It's like I tell people, it's a good gig if you can get it. It's not good for people, though.
Right, right. So that means, so after the HPV vaccine, they use a control group and they realized that we made a mistake because that's not good for the business. So they started using other vaccines as control.
Yeah, exactly. Or sometimes they use the adjuvants as control.
And what do you think about the aluminum? There's aluminum in this vaccine. How is aluminum detrimental to human health? Because the parents who are watching this video must be aware because the vaccine, HPV vaccine, contains aluminum.
Yes, a high amount. And why is it in there, first of all? Because antibodies mean your body is reacting to poison. And so the more you poison somebody, the higher, quote, antibodies. By the way, they've never purified an antibody. It's just your body's chemical reaction to being poisoned. So they want a robust antibody response. So they put a lot of aluminum in there. And all I can say about aluminum is Aluminum is 0% absorbed through the GI tract.
Mm-hmm.
You can eat aluminum, you can eat your dish pan and it won't do anything to you except you won't like it. It doesn't even get absorbed through the skin.
Mm-hmm.
There are no reactions in a living being that use aluminum,
Mm-hmm.
and there is no excretion pathways for aluminum.
Mm-hmm.
So I tell people if you come across a substance which never in nature gets absorbed through any route, in which you have no use for it in any reaction, in which your body has no elimination pathways, don't inject it into your body because it's not supposed to be there. That's like not that complicated. And
Right.
that's what a vaccine is. And unfortunately, the HPVs have the highest concentration of aluminum and some other things.
Right. And there's a very, very important question. This is the most important one. There is one doctor in India. He said that if lots of girls are injected with HPV vaccine, we are going to see rising cases of infertility and ovarian insufficiency. Do you think this is possible that girls might get infertile? The doctor said that this vaccine contains sodium borate, which might lead to ovarian failure.
Yeah, I don't know which component it is, but absolutely. Infertility and other kinds of cancer, which will not be recognized as being part of it, and all kinds of so-called autoimmune diseases. By the way, the reason I say there's no autoimmune disease, the definition of an autoimmune disease is a disease caused by an antibody.
Oh.
There is not one study in the medical literature that shows they purified antibodies, gave it to a person or an animal, and caused disease. This is just a scam, a cover up. Antibodies are a kind of protein you make when you're poisoned. So if
Right.
you poison somebody, you make antibodies and then you get sick.
So that means the antibodies are not the culprit.
They are not the culprit.
The poisoning that happened was the culprit.
You're reacting to being poisoned.
Hmm.
And they blame it. And this is simple science and logic. I'm willing to say it's because of the antibodies, but you're going to have to, if you say hammers knocking nails, don't hit that nail with a toolbox and tell me it's because of the hammer,
Hmm.
right? So show me an antibody that makes somebody sick or an animal. I looked for 2 years, there's not a single paper.
Right.
So it's a scam.
So, right, doctor, if we do some serious calculation, they're claiming that they're going to inject more than 1 million girls with this HPV vaccine. And if we try to figure out the scale of damage, 2.3% is the confirmed side effects from the vaccine manufacturers. So 1 million girls injected would lead to irreversible diseases in 230,000 Indian girls. Is that correct?
No, 23,000.
23,000?
I think so.
1 million?
Uh, well, if 230 would be 23%.
Right. Oh, and let me just confirm if it's 1 million or more. Okay, so
It's 23,000. I think it was 15 million girls.
uh
So if you do the math, 2.3%, but that is the tip of the iceberg. Every person who's injected with HPV vaccine will be injured.
Right.
Some horribly so, some minor so,
Right.
some will be infertile, some will get cancer, some will have what are called autoimmune disease, some will have, psychological issues, ovarian problems, uh, all kinds of things because
Right.
you're being poisoned. And this is the risks. These are
Right.
not side effects. These are the consequences of injecting yourself with poisons.
Right. So
There
so
are
let's
no benefits.
so let's
It has never prevented anything because there is no HPV to cause cervical cancer.
Right. So let's be clear here. So if 15 million girls are injected with this vaccine, approximately 230,000 girls are going to get seriously affected by this vaccine with diseases like psoriasis, arthritis,
Yes.
paralysis, celiac disease, type 1 diabetes, and many more. And the others who are not getting these serious side effects at that point of time will still suffer because they have been poisoned.
That 2.3% was in the first 6 months.
Oh.
So they stopped doing the experiment at 6 months. So you have no idea what's going to happen in 2 years, 10 years, 20 years, whether they get who knows what. And they don't want to know.
Right.
So that 230,000 is direct, fairly immediate. I mean, it depends your definition of immediate, but to me, if you inject something and 4 months later you have type 1 diabetes, that is an immediate effect of that vaccine
Right. This seems to be a more of like a criminal conspiracy against the Indian girls. And what I know is that Bill
against the
Gates,
world. But yes, Indian girls in this case.
right, and there's Bill Gates who's behind this vaccine. Can you explain what's the agenda of Bill Gates with all this?
So I'm going to differ a little here because I actually think that these kind of people like Bill Gates and Zuckerberg, they're irrelevant like stooges. It's not Bill Gates deciding to do this. He's just the front man for an organization, a agenda which is beyond belief. And I don't know who it is, and I don't exactly know what their goal is, but it's not something that you or I want to participate in. And it's not any of your listeners out there, you don't want to have anything to do with these people. They do not have your interest. Bill Gates is just the front man for this. That's why if they throw him in jail because of child abuse or whatever, the whole thing will just keep going. Like that's not the end of the vaccine agenda, right? And so it's actually futile to put your energy on Bill Gates. He's nobody. And again, I don't know who's doing it, but it's bigger than that.
All
I just wanted to clarify. We're it's not that I'm a fan of Bill Gates, right? It's just that he's not like the head of the snake.
So Bill Gates made a statement in TED Talk in 2014 saying that if we make good work with the vaccines, we might be able to depopulate or reduce the population of the world by 10 to 15%. So I was just curious that if we make good vaccines and good healthcare, how are we going to reduce the world population? I couldn't wrap my head around that. Can you throw some light on this so that our audience can know that why they're being given this HPV vaccine free of cost?
Uh, what's so interesting about that is they being these sort of psychopaths who run the world, they have some kind of unwritten code that they have to tell you the truth, but they can do it in code. And then they can say, well, we told you that we were going to depopulate you and you agreed. So what's your problem? Like you signed up for this. I told you that the purpose of the vaccine program was to kill 10% of the world's population, right? There it is. I just told you. So you signed up to do it, and then something bad happened. I mean, what do you expect? We told you.
Uh,
So he's right.
it's crazy. It's crazy. These people seem to be psychopaths. I don't know what benefit they want from depopulating the world. Like, what is the stomach pain that they have?
I don't know. I mean, they have a thing against brown people, and it's just they're psychopaths,
Hmm. All right.
but
So let.
they're also followers of certain kind of religious tenets.
Mm-hmm.
So that's one of the things that it's hard to sort of get. they actually seem to think they're doing good stuff. It's just that they are worshipers of like the horned goat god, and the horned goat god says you got to have the world a certain way, which is a pretty weird way, but that's what the horned goat god says. And so they are believers in that, apparently. And so, just like any cult, they think they're doing the right thing.
Right. All right. So let's come to an important question, which is the HPV vaccine associated with death? I mean, there is possibility to die from the vaccine?
Yes,
Hmm.
no doubt about it. They
Hmm.
won't, they, it'll be hard to get numbers for that because, I mean, I learned in the ER that people, we'd have children who came in and the 2 days or a day after they got their, 2 month shots, they died of SIDS, which means they just died in their crib. And we were told very clearly, you do not say this had anything to do with the vaccine.
Uh-huh.
So we called it SIDS, which means sudden infant death syndrome of unknown cause.
Hmm.
And if I, as a doctor, would say, I mean, because I was the one who had to write that, I
Hmm.
got out of that business. It
Hmm.
was just a few years as I was sort of building my real practice. But I mean, in my practice for 37 years, I gave 3 tetanus shots. And those were under sort of duress. Not that I exonerate myself, because I've apologized to those 3 people for doing a stupid thing. But that's it. I refused otherwise. But as an ER doctor working for this corporation, right? I worked for the hospital. If I didn't do that, I'd be fired. And so I learned, if somebody came in with SIDS, that was 2 days after MMR, 2 days after DPT shot, you call that SIDS.
So that's sudden infant death syndrome.
Right, of unknown cause.
I think that should be sudden immunization death syndrome.
Sudden vaccine poisoning death syndrome.
Yeah, that makes more sense. So I was looking at the statistics and it says that in 1980s there were about 3 to 5 doses of vaccines that were given in the children and the rates of autism were less. And as the vaccines doses went up, the rates of autism, brain retardation, neurological impairment also went up. Now they say that there is only correlation between them, but there is no causation. So, what do you want to speak about this? Is there causation with vaccine poisoning and brain retardation?
Yeah, I would only be careful to, you see, one of the biggest scams of all is there are specific diseases. And what I mean by that is you say to somebody, okay, how do you know that somebody has autism? Right? I'm a doctor, right? I need to know how do I make sure I diagnose this? Well, they have excessive pencil tapping like this, you know. So being a smartass that I was, I asked him, how many times a minute do you have to tap your pencil before you get diagnosed with autism? So I was on a panel once and the pediatrician said 20.
Uh-huh.
So I said, so if you tap 19 times, you're fine. And if you tap 21, you need Ritalin. He said, yes. I said, you're telling me that's a biological entity that is related to how many times a minute no, well, it's also with excessive loud voice. So I said, so like this, right? Not like this.
Uh-huh.
I mean, this is nonsense. All you can say is there's a lot of children now who never used to be the case, who don't act right. And they're for a whole lot of reasons. It's not just the vaccines, but vaccines, food, and other reasons. The rate of children who do not act the way that I would think a healthy normal child acts is unbelievably high.
Mm-hmm.
And I have no doubt that the vaccine agenda was specifically
Mm-hmm.
geared towards creating such a situation.
Mm-hmm. 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 There are certain doctors, they claim that the vaccine industry is based on the fundamental principle that you inject the children with poison early on so that later they grow up to become sick and they have more customers basically for their pharmaceutical therapies. Is that true? Do you feel that this could be the case?
Yes.
Mm-hmm.
Here's another thing I think, and I don't usually say this publicly, but and I don't have proof for this except with the COVID shots. See, one of the things you'll encounter with when you tell this to people, vaccines are poison. There's no benefit, none of them. They just make you sick. And people will say, "Yeah, but I know 30 people who got the COVID shot, none of them got sick." What we learned for the first time with the COVID shots was there is a huge difference between batches.
Oh.
And they did it very cleverly. So the ones with the high amount of poison in it, they
Mm-hmm.
sent to very different places
Mm-hmm.
instead of sending them all to one place like they usually do.
Mm-hmm.
And then a significant percentage of them were just nothing
Ah.
because they knew we're not protecting anybody from anything. And so if we put 80% of them with just saline, people are going to say, yeah, but I got it. Nothing happened to me.
Yeah.
And I would say that has been definitively proven with the COVID shots.
Uh-huh.
And here's a speculation, and maybe I shouldn't do this. I think they've been doing that with all the vaccines.
Uh-huh.
And that's why, my children got MMR, nothing happened.
Mm-hmm.
They got DPT, nothing happened.
Mm-hmm.
You have doctors say, yeah, a lot of the children who get vaccinated, they do fine. So, how many of them have actually taken these vials and
Uh-huh.
examined them biochemically and under a microscope and really done, due diligence to find out what's in these different batches? N- Nobody.
Mm-hmm.
And they say, well, the FDA is monitoring this.
Mm-hmm. Yeah.
Right. Oh, well, that now I feel better. The government is on it, right? or Pfizer is looking into it. So that would now, phew, we're okay now because Pfizer wouldn't do such a thing. Well, we know that they did it. And so this may be diabolical, but I think if I was running Pfizer, I would do that. Because I wouldn't put all that stuff in every single vaccine. Because, and not only that, but whenever you see them running out of vaccine at a certain time, you see they time it so the ages of the children. So it's hard if you gave a shot every to everybody on September 1st, September 15th, you would say, hey, what happened here? Everybody was okay in August. So you space them out.
Mm-hmm.
And then, well, everybody, it's nothing in particular.
I have a question that you said that for the previous vaccines, it is a speculation, but for the COVID vaccines, you are definite about it. Do we have a like a proof or something that we can present to the public that the COVID vaccine were distributed in batches? Some were toxic and some were like
There's
mild.
a, there's a website called findyourbatch.com,
Uh-huh.
and you if you were injured with the COVID shot, you can look up the percentage of injuries with that vaccine
Mm-hmm.
batch,
Mm-hmm.
and you can also see where that batch was distributed. And
Mm-hmm.
it is wild because they usually distribute, one batch goes to Texas, right? And one batch goes to Shreveport, Louisiana, and one goes to Toronto and blah, blah, blah. But the ones that were the high side effects, and we're talking 10% versus 0%, they were all over the place.
All right. So here is my
So it
conspiracy.
wasn't just, oh, it wasn't like everybody in Toronto got, sick.
Uh-huh.
These people are clever.
Mm-hmm.
You can't, you should never underestimate the quote genius of the people running this virology scam.
Mm-hmm. All right. So if I think a bit more about this, there is the Department of Justice in the US released Epstein files in one of the emails. It's associated with Bill Gates. It says how we can get rid of the poor people. And now in India, when they're giving the HPV vaccines, is it a possibility that they might send those vials, the dangerous ones, in those regions where poor girls are living?
I wouldn't put it past them, but I have no evidence that that's going to happen.
Mm-hmm.
But if it was me, first of all, I wouldn't get anywhere near any vaccine. And the HPV is one of the worst. But second of all, if we actually had, well, I'm not a fan of any government, but if the people would organize themselves and saying, even the doctors who are the most useless of all, I want to see those vaccines. I want to make a lab, hire some analytical chemists, and tell me what's in those vaccines. So Tom doesn't have to speculate and make a fool out of himself. And I don't know whether that's true, but I would not put it past him. And I wouldn't believe anything they or the government says about it. I would have, somebody who's willing to, put up the money, actually send them to a independent lab, have them tested, and see what's in these different batches.
Right. Doctor, you mentioned that the doctors are useless. You yourself are a medical doctor and you are saying that the doctors are useless on this subject. I would like to know that this is a pinning question. In India, we have lots and lots of doctors that are coming online and making reels and saying that the government has launched an HPV vaccine drive and all the girls should take it so that they can prevent cancer and they have no side effects. It's completely safe. And they have been shouting this all through the Instagram and YouTube. So, what do you want to tell those doctors about this?
There's nothing to tell those doctors about anything. They are completely indoctrinated and brainwashed. Now, and people say to me, how can this be? Well, first of all, I went through the training and nobody asked the question, how did they isolate the virus? Who proved there was an HPV? So nobody asked that question. But think of it this way. Imagine you're a 42-year-old, fairly young virologist, right? And you're working for a big virology, institution. And you happen to hear this interview with this idiot Cowan, and he's saying there's no viruses, and the way to prove it is to do a cell culture and do an electron microscopy with and without a sample, and to do the genome with and without a sample, and you'll find the same thing. So I'm going to prove this Cowan wrong. So I'm going to do the test. We did a whole viral challenge explaining how they can prove that we're wrong. So he goes off, he does it for 6 months, and at the end of that, he says, "You know what? Cowan's right." So he writes a paper explaining everything he did, very meticulous. Here's what we found. He shows it to the head of the department. He says, "Look, I got this paper. I've shown that the whole thing is a scam, and and we don't need to do this anymore." And the guy looks at the paper. He says, "This is great work. You really did everything right. And by the way, you're fired. And if you publish that paper anywhere, you're going to end up in prison."
Right.
So he goes home to his wife, right? Got wife and two kids. They go to private school. He has a Mercedes. He says, wife says, "How was your day?" "That was good. I had this paper. I showed it to the guy, and he said it was great paper. And then what happened? He fired me. So how are we going to pay for school and my Mercedes and my go to the spa?" "Well, I thought I would grow carrots."
Hmm.
wait a minute, you don't know how to grow anything. You've never done anything in your life but do virology.
Yeah,
So what's he going to do?
right.
And that's where all these people are.
Hmm.
They've got $200,000 in student loans. They're the only the only way they can get a job is just like me. You have to do what you're told. And if somebody comes in 2 days after a shot, you write SIDS on the paper.
Yeah.
And if you come home to your wife and say, I told them it's a vaccine injury. Oh, good. What happened? They fired me. I mean, nobody's going to do that except people like me.
Right. And that's the reason
But
why
I
we
made a plan early on. This is how I'm going to do it. And
right.
I'm going to figure out how to help people with food and
Uh-huh.
herbs and cleansing, all that stuff. I didn't go into this just blind.
Right. And that's the reason why we respect you, we honor you for your decision that you have done, and the information that you bring to us is valuable. So, and here's the question about the moral responsibility and ethics. Just give 1 minute statement to all these doctors that are promoting the vaccines that there is a moral responsibility because it's the life of the children of India, the future of the country.
Yeah. You got to ask yourself, see, what's the problem is they're scientifically illiterate. And you need to ask yourself, how did they prove these things? How did they prove there's a virus? How do they prove it's the cause? How do they prove that this vaccine works? You need to know that information. And until you do, the idea that you would give somebody an injection of anything, which you don't even know what's in there, they don't even know what's in that injection. I mean, this is criminal. And again, I'm not a big fan of the government, but they should be held somehow morally responsible. The community should rise up and say, we are not going to tolerate these people anymore.
Right. Thank you so much for giving these information, sir. And we have last two questions left. One is about the polio. Usually, when we bring the topic of vaccinations, that they are not good for health, they are poisonous, they often say that we used to see so many cases of polio earlier on, but since we introduced the polio vaccine, we do not have paralysis polio anymore. So, is the virus causing the polio disease, and is the vaccine effective in preventing that? I would like you to throw light on this.
So there is no evidence of a polio vaccine, a virus ever that has been. I stake my entire reputation and career on that. And the polio story is fascinating because right before the vaccine was rolled out, in order to get a diagnosis of polio, you had to have an acute illness and paralyzed for 1 or more days, right? So anybody with an acute illness, paralyzed, that was polio. After the vaccine, they changed the diagnosis to an acute illness and you had to be paralyzed for 4 months. So 97, 98% of the people who you claim have polio don't have paralysis for 4 months. So you get a 98% reduction just because you change the diagnosis.
So you
And
mean,
then, for instance, India in the last decade has had 300,000 cases of what they call acute flaccid paralysis.
yes.
What, what is the diagnosis of that? An acute illness followed by paralysis. That's polio. What about Guillain-Barré syndrome? I saw lots of people with Guillain-Barré. What is the diagnosis? An acute illness followed by paralysis. This is a scam. They did it with COVID. They do it with smallpox. They do it with measles when they want, because these are not specific diseases. That's the scam. When they want to say there's an epidemic, chickenpox, measles, monkeypox all become smallpox. And when they want to say that we got a vaccine and the epidemic is over, smallpox is gone, and so now it's monkeypox and chickenpox and measles and scarlet fever, etc. Like I say, it's a good gig if you can get it and you're a moral degenerate.
It's kind of like, so we have iPhone 11 and then 12, then 13, then we have the Pro version, the Ultra Pro version, and this is how you make business out of it.
Yes,
Right. Um,
exactly.
so
And
the
and interestingly, the CDC admits there is no clinical diagnosis of, say, measles
uh-huh.
or polio. There's no symptoms that tell you that somebody has measles or polio. Therefore, before these molecular diagnostic tests like PCR, nobody had any idea who had any of these. So all the statistics about who had it and who didn't is pure nonsense.
Hmm.
And besides that, with polio, it turns out that lead, arsenic, and DDT both cause paralysis and they target the anterior horn cells of the nervous system, exactly the site where the virus allegedly attacks. And so they, at the time of the polio vaccine, they got rid of lead arsenic and DDT, shipped it to India, by the way. And so then they got their polio epidemic, and then they they stop, and then it's acute flaccid paralysis because those stupid Indians, they don't know anything. I mean,
But
this is a scam.
yeah, exactly. This same information I tell to people, it's very hard for them to wrap their mind around this, and they start blaming me.
Yeah.
Yeah. And so we come to the final question, which is about the rabies vaccine and the tetanus shot. So usually people have these two questions that if I get injected by a nail, should I go for the tetanus shot or not? Otherwise, I might have that problem with the tetanus. And the most dangerous is with the rabies. So if a wild dog bites me, should I go for the shot or not? Because they have shown the videos of people having rabies and they die horribly with that disease. So people are really, really scared about this.
So I have my rabies fact sheet here. I because a lot of people ask me about. So first of all, like all the other viruses, nobody has ever seen, isolated, purified, found a rabies virus. Now, I'm not saying that getting bitten by a dog is good for you, because dogs have lots of things in their saliva. But here's some facts that I got just from the CDC and other reputable sources. So, according to the CDC, between 1980 and 1996, there were 32 people in the United States who had clinical rabies. Okay. Seven of them had an animal exposure, that's 22%. 25 had no known animal exposure of any sort, that's 78%. According to the CDC, since 1996 to 2025, 37 cases of human rabies, 30 acquired in the US, 28 had no exposure to an animal of any sort. Next, in the 1990s, in an investigation at the Philadelphia dog pound, there were 6,000 vagrant dogs admitted annually, thousands of bites over 25 years, more than 150,000 dogs, zero cases of rabies. In the 1900s, at a hospital in London called the London Hospital, they have records of 2,668 people bitten by dogs, zero cases of rabies, zero deaths, zero treatment. In the 1900s, St. George Hospital in London recorded over 4,000 dog bites, zero cases of rabies. The pathological hallmark of in the brain called Negri bodies or black bodies has been shown to be associated with many other conditions not specific to something called rabies. Now, the Pasteur Institute in France has recorded 3,000 cases of death from rabies. Every one of them was treated with the rabies vaccine. So if I look at these facts, I come to the conclusion that the best chance you have of dying from rabies is by taking a vaccine. There is no evidence of just wild dog bites causing a disease that we would call rabies. And by the way, when Pasteur, who worked with rabies, uh, he did experiments with anthrax as well. And he tried to show that anthrax spores cause disease in animals. And he did experiment after experiment, never found anthrax spores to cause disease. So he made what he called enhanced anthrax, which is he mixed the anthrax with arsenic.
Oh.
Then it caused disease. And
Mm-hmm.
he said, see, I knew that the anthrax caused disease.
Mm-hmm.
That's called a scam. And he was the one who started the rabies virus scam.
Mm-hmm.
Now, the other one was tetanus. So I was an ER doctor and I supposedly had lots of wounds, right? And I looked at the CDC guidelines on how to know if somebody has tetanus.
Mm-hmm.
And okay, because that's my job, right? I got to know how can I look at somebody and know they have tetanus, or what sort of lab tests that I should run. And so they say the bacteria, this Clostridium, makes a poison called a tetanus toxin, and that's what causes the spasm of the muscles.
Mm-hmm.
So the CDC says to this day, you cannot look for the tetanus toxin in the blood of somebody to determine whether they have rabies, because whether it's there or not makes no difference to whether they have symptoms. Well, that's weird because I thought that's what was the problem. And then they said, and by the way, don't bother testing the tetanus antibodies because we now know that antibodies to tetanus are not protective to clinical tetanus. And then I found a study that was really so in the old days they used to hyperimmunize people or horses and then collect their antibodies, right? And then if you didn't have a tetanus shot and you got a tetanus like wound, they would give you the antibodies. So they had this guy and they gave him like 30 tetanus shots and he made like 10,000 or so times more antibodies than a normal person, right? Lots of antibodies. You know what happened to him? He got tetanus.
Uh,
And they wrote it up in the Journal of the AMA saying, well, it turns out tetanus antibodies don't protect you against tetanus because this guy had 10,000 times the number of antibodies and he still got tetanus. So it's a scam. There is no vaccine that has any benefit, it's all risk.
right. So the vaccine won't prevent or reverse the disease that is tetanus and rabies. But if it's not the vaccine, then how do we prevent ourselves? Like if someone gets bitten by a dog or they're really serious that I don't want to die that horrible death, what is the precautionary measure they can take for that?
You first have to clear your mind that there is a specific disease called rabies and that it's caused by a virus and that this is a death sentence because all the facts say that's not true. But this is a very difficult situation because having once been bitten by a dog, it was one of the most terrifying events of my life. And I did not say that being bitten by a dog is harmless. Dogs have powerful enzymes. They can eat the head of a rabbit, right? And digest it. And all that comes out in their poop is a little pellet. So they inject a lot of powerful chemicals and digestive enzymes into your tissue, and that can be a problem, and you can get sick. And so, you need to work with somebody who can. I can't say, do this, this, and this. It depends on the situation. But there are ways of dealing with this. But the first and most important is everybody who's bitten by a dog will be terrified. And fear is probably the most potent pathogen there is. So you've got to figure, that's why I read these things. There is no evidence that this disease called rabies is associated with anything but rabies vaccines. Even the whole thing is ridiculous because they say you can't give a vaccine after you've been exposed. So what do? You've been exposed to the rabies virus, then they give you the vaccine. That one of the ways of knowing what a scam this is, if somebody says antibodies protect you against disease, antibodies mean you're going to die, and that doesn't make sense to you because like that doesn't make any sense, you should that's a dead giveaway that something is wrong here.
Right.
If somebody says you have to give the vaccine before the event, not after, and then you go in and they say, well, you had the event, and so now we're going to give you a tetanus shot. You say, wait a minute, I thought I had to have the thing before. Well, yeah, but this is for the next one. This is like, and these doctors who are spouting this stuff off, they are scientifically illiterate, as was I. I mean, I didn't, I didn't know,
Right. Right. So let's
but I looked into it.
so the last question would be unvaccinated versus vaccinated. If I have a child, I have five children, and I want to have the best of their health, I do not want them to get sick early on. What's the best to inject them or not inject them? This is for the new parents who are going to have kids now, so they should know what's the best for your child's health, getting them injected or not injected. What is the scientific evidence on that? Who are healthier, the ones who got all the vaccines or the ones who got no vaccines?
I mean, there have been studies showing unvaxxed are much healthier, but all you need to know is nobody has ever demonstrated a virus. There is no benefit from a vaccine.
Mhm.
There is no benefit from a vaccine. I'm going to say it three times. You cannot expect any prevention or treatment or reduction of any disease from a vaccine because the mechanism, the causative link is actually not there. So the only possible outcome is worse health. That's the only possible outcome from one vaccine, a thousand vaccine, or anywhere in the middle.
Thank you so much. Thank you. I mean, like this information is like really important, and because most doctors in India, and I think as you said, maybe in Canada and US
Yeah,
also,
everywhere.
yeah, they really need to know this stuff. And I'll try my best to put this information in small clips, and I'll give that subtitles in the Indian. I'll try to give in the Indian language and also give a narration in the Indian language so that the people and the doctors can try to wrap around their head with the new information and make the best use of the knowledge. And especially, I wanted to do this interview because it's about the future of the children and the girls. So thank you so much for joining us today,
I,
Doctor.
and I just want to say, Kamal, that I really appreciate your doing this and being open to it. And all I can say is, my heart goes out to these people in India or all over the world, and in the U.S. and Canada. But to do this to, you know, like simple, honest, hardworking, poor people, I mean, that's just way over the top. I mean, and to do that to the honest people of India and harm their girls and their children, I mean, this has got to stop.
Right, right.
It's terrible. It's just terrible.
Thank you so much, doctors, for sharing your valuable wisdom with us. Um, and
All right.
I hope I asked the right questions.
That was, I think we got it.
Yeah. And I think I have a lot to learn. I learned a lot of things from it, and I am still questioning more concepts. And I think maybe we can come together once again in some future time and discuss some more points, dive deeper into this. And
Yeah.
I'm sure you would have also went deeper
I mean,
into.
I've gone a long way since that book,
Yeah, right, right, right.
and we have a website. Every week I do a webinar and talk about measles and talk about all this stuff.
Can you name?
DNA,
Mhm,
you know, uh, heredity. It's biology is a scam. Science these days is a scam. They decided, just let me finish with this. They decided 150 years ago, whoever they is, that there was two creation stories. One is the story of Adam,
mhm,
Adam, which is there's a God, there's a creator,
mhm,
and all life was is essentially a a emanation of a creator,
mhm,
right? And Hindus have their story and the Buddhists have their story, but it's all the same sort of story.
mhm,
And the other story is the Atom story. So they're mocking you, Atom. And that story is uh, 12.6 billion years ago, there was nothing. And then a car backfired. Never mind where they got the car from. And then all of a sudden, there was everything. And all the atoms, they were like billiard balls and they just random bouncing around. And then they bounced around and became chemicals and bounced around and became viruses. And they kept bouncing and they became bacteria and then fungus and then frogs and then gorillas and then Uncle Harry. And when Uncle Harry got formed, that was when Aunt Sue, otherwise the whole thing would be for naught. And there's nothing here, there's no direction, there's no purpose. You're just random collection of bouncing billiard balls. Get over it. That's called modern science. It's hogwash.
Yeah,
No,
right.
nobody, nobody but a scientist would believe that story.
Yeah.
It's all random. Kamal, just get over it. Why did I get sick? Bad luck.
Yeah.